Good morning, good afternoon, and good evening, honorable ministers, distinguished guests, ladies and gentlemen. Thank you for joining this side event on the importance of addressing childhood obesity today to protect the health of future generations. We choose to call these sessions Future in the Balance, because that is exactly what is at stake here. The future health and well-being of today's generation of children and young people, as well as the generation who will come after them. As I was preparing for this session, I thought a lot about conversation I was privileged to have a few years ago with the Honorable Joe Williams, the former Prime Minister of the Cook Islands, who sadly passed away last year. He told me one of his greatest regrets as a politician was not being able to do more to protect the health of future generations. I think of these words often as a plea to all of us to do more. Childhood overweight and obesity is one of the most serious public health challenges we face in the 21st century. Childhood obesity rates have skyrocketed in recent years in our region and around the world, especially in urban areas, as a result of increasing sedentary lifestyles, the availability and affordability of ultra-processed foods high in fat, sugar, in salt, and the aggressive marketing of these foods to children and their parents. Right now, 1 in every 4 girls and boys in our region is overweight or obese. This affects a staggering 93 million children. Rates of childhood overweight and obesity are increasing exponentially, meaning that we are fast hurtling towards a future where half of all our children in the region are overweight or obese. This is an unacceptable threat to these children today and to their future health and well-being. I believe that we have a moral imperative to do all we can to change this future. The health problems that come from childhood overweight and obesity are wide-ranging and significant. Overweight and obesity increases the risk of cardiovascular diseases such as heart diseases and stroke, diabetes, musculoskeletal disorders such as osteoarthritis, and the range of cancers. It can also contribute to mental health problems such as depressions and other social challenges such as discrimination. Are we really comfortable that this is the future we're condemning so many of our children to? If not, then now is the time to act. Tackling childhood obesity is not straightforward, but it is urgent. There's no one single simple solution, but we know that through a combination of policy and regulatory measures, we can make a difference. And I'm really looking forward to hearing about the different ways of countries and communities around our regions are addressing this challenge during today's session. I hope the examples we hear about today will motivate and inspire policymakers and leaders to scale up efforts to tackle childhood obesity as a part of countries' commitment to achieving the nutrition-related SDGs. After 22 months of response to COVID-19, it has made it clear that health and broader social and economic development are inextricably linked. Therefore, investing in health today will be a critical determinant of economic and social prosperity tomorrow. And this is why we must act now to reduce and prevent childhood obesity, because this is an investment in the health and well-being of the children today, as well as an investment in sustainable development for the future. I look forward to working with all of you to achieve this. Thank you very much.